So, as listeners, yes. So you had Louisa and Miss Ellery. A special welcome to our regular listeners, our market vendors, bus drivers, staff at the various business places around Soufriere. We have some regular listeners also in Choiseul and Canries. Welcome to all of you, and I hope you will stay tuned for the entire program. We are having a virtual guest this morning, so we're working out the technicalities at the moment. And I hope that this week we will be able to run smoothly because we don't have in studio today. So, our guest is a nurse. She works in Health Region 5, which is the region where I work at the Viewfort Wellness Center. She's a nurse who has a lot of experience, both hospital and community. Once we get her on, I will allow her to do a bit of an introduction, tell you who she is. She's knowledgeable, she's experienced, and hardworking. That I can guarantee. So, our topic this morning is family planning. So, we're trying to talk about some of the services that are available at the various wellness centers around the island. Family planning being one of them. And we try to link it. As you know, when we spoke on our first program, Louisa and I, we mentioned that we would like to link the topics that we do with the month of observance, not necessarily from one health observance calendar, but various, especially on topics that are not usually spoken about. So today we have one of them. I don't think we very often speak about family planning.
Now, you make mention of family planning. I have had two things going through my mind: contraceptives, and of course, building a family in terms of taking that next step in life.
Okay.
So I want you to be precise,
Okay.
be specific.
Yes, I'm coming to that.
Nice,
You
nice.
know that, Ulan. I can either come to it or wait for news, but since I think we're still waiting for news. Yes. She's there. Okay, so I'll just give a little introduction on family planning. So family planning is really about allowing people to have the number of children that they would like to have or not have. I think many of us may be the products of unplanned pregnancies, and there are many young adults who are also the products of unplanned pregnancies. So, family planning, really, as Ulan said, is about planning the family, how to space what number to have, at what point, at what age, and really and truly, it should be a personal choice. Nobody should be forced to have children if they don't want to or have more than and so on. So that is what we're going to be talking about. There are several different methods. There are various methods that can be used, and I'm sure Nurse will be speaking about some of them, those that are offered especially at the various wellness centers. So welcome, Nurse and Catherine. It is a pleasure. I'm so happy to have you with me this morning.
Good morning. I am happy to be here.
Welcome. I was saying to our listeners that you are a very experienced nurse. You worked at St. Jude Hospital. You have worked in community for a long time. So I don't know if you want to add anything to that before we get into the topic of discussion this morning.
Well, I am just happy to be able to extend impart my knowledge on our people who really need the information. And I have been on this for a long time. I love nursing, and I will continue to do nursing until I cannot do nursing anymore.
Now, nurse, even after you reach retirement age, you might still be able to do some nursing. So you're going to continue after that, right? You're going to volunteer.
Definitely, because I just love my job.
I know you love your job. I also said to them, you are a very hard working nurse,
Yes,
without a doubt.
definitely.
So this morning, let us talk a little bit about family planning. You can start off however you like. Ulan jumped up and started speaking about some of the different methods he mentioned. What was it other than contraceptives? So there are
Yes.
different types of contraceptives. I don't know if you want to start there. You just
Okay.
take it as you like, and
All right. Thank
we'll continue.
Yes, thank you so much. So, of course, we know voluntary family planning is important for the health of women, children, and families. Um, and contraceptives are one of the ways that you decide how you're going to plan your family. So, contraceptives, simply put, are the use of drugs, devices, or surgery to prevent pregnancy. Some people may be wondering devices, surgery, but as we go along, I will expand on those and you will understand what I'm saying. So, how do birth control methods work? One of the ways they do is they prevent the sperm from reaching the egg because we all know when a sperm and an egg join together, then we have our little babies being formed. They also inactivate or damage sperm. And I will get into that and I will tell you how. They also prevent eggs from being released each month. So we know anatomy wise, physiology wise, an egg is released from the ovaries, goes on to the fallopian tubes, and they get fertilized by the sperm, and that's how we get a pregnancy. Another way is they alter the lining of the uterus, so the fertilized egg does not attach to it, and then where we have a pregnancy. It also thickens the cervical mucus so that the sperm cannot swim how you're supposed to. Yeah.
So these are
The other
various
thing
methods
is
that are used, right? So there are different
yes.
methods that
So this
cause those different results, right?
yes, yes.
Oh,
So I will get into a little bit of it in a little bit. But these
okay.
are the ways that the contraceptives, the birth control. So contraceptives, birth control, I'll be using it interchangeably and they're the same. So the next thing is deciding which method is right for you. When deciding which birth control or contraceptive is right for you, there are many factors you have to consider before you decide which one. So the first thing is your reproductive goals. Do you want to have children someday? How soon do you plan to have those children? And also the number of children that you want to have. Another factor to consider is your age, your health history. So we have people. So when I say your age, we know that the older we get, the more difficult it is to get pregnant.
And why is
So you know
that?
your one of the reasons is when a woman is born, she's born with so many eggs. But as we get older, our eggs, the amount we have, they diminish. It gets depleted because the amount of hormones we have in the body at that time as well gets depleted. So by the time you hit 35 and by the time you hit between 35 to 45, it is more difficult for you to get pregnant because you have less eggs in there.
Okay, so nurse, you tell me I got lucky.
Yes, yes, fun.
I got very lucky.
But the other thing is, um, everybody is different, and some people it is um, they get pregnant quicker than others. Some people may try to get pregnant for years and it doesn't happen. Sometimes by the time they hit 40, that's when they get pregnant after they've been trying for so many years. So everybody's fertility health is different. There is no one rule that hard and fast rule that goes for everybody. It's different for everybody. Health history wise, so we have to look at does the person have lupus? Do they have sickle cell, diabetes, high blood pressure? All of those little chronic illnesses can hinder getting pregnant.
And would
Another
it
thing
also make pregnancy riskier, nurse?
yes, and then it would make your pregnancy riskier because you would have to be monitored more frequently, and sometimes you may have to be hospitalized.
Okay.
Another factor to consider is the relationship factor. So, is the person married? Are they single? Do they want to be a single mother? You know, sometimes you have to ask about the number of sexual partners. We know, I mean, not normally what we know is you're supposed to have one man and a lady in a relationship, but sometimes everybody has their own thoughts about that. Some people may have more than one sexual partner. Another thing, partner preferences. So, we have alternative lifestyles these days. So maybe, just maybe, sometimes you never know, pregnancy can happen. Somebody may decide, okay, I want to get pregnant. I am in this alternative lifestyle, but I want to get pregnant. Another factor to consider is how they use the contraceptives. Yes, our contraceptives prevent us from getting pregnant, but they do not prevent us from getting an STI. So we have HIV, hepatitis B, you have syphilis, you have gonorrhea, you have BV, you have trichomonas, and all of these, you have to be very mindful of those. Another one is, how well does the method work? For some people, a barrier method is effective for them. For some people,
So when you say barrier method, Nurse, could you explain to the public what you
yes.
mean by a barrier method?
So
Since
when
we're
I say
talking contraception.
yes, so when I say about a barrier method, we're talking about condoms. So we have the male condom and we also have the female condom.
Now, the female condom is not very commonly used, right?
No.
Oh.
Some people say that's like being really a raincoat.
What they said?
Did you
I didn't get
did you
that.
hear what was said, Nurse?
No,
Ellen,
I
could
no, I
you
didn't.
repeat? Ellen, could you repeat so at
Oh,
least?
I say that is a wonderful conversation happening there. Come to think of it, of course, you have some persons like to have unprotected sex because some of them says like wearing a condom is like bathing in the rain for raincoat.
Yes. So of course, we have some persons who have their preferences. So we have the male condom. The male condom, it's a thin sheath made out of latex, animal skin, or polyurethane, which is some material that they use as well. That is worn over the penis to trap sperm. Yes. Now, some of the advantages of that is it's easily available. We have it at the health center. We don't sell it, so you can come up to the wellness center and say, nurse, can I get some condoms, please? And once it's available, you will get the condoms. You don't have to pay for it. Another one, it protects you from STDs and HIV. Yes. Some of the disadvantages is it may reduce sensation, just like you said earlier. So some people do not like to use it because it reduces sensation. So that's one of the reasons why they don't like using it, and they think it's like going in there without the raincoat. Yes. The other thing is some people we may not use it because either them or the partner may be allergic to latex. So that's another reason why the condoms are not so popular with some people. Some people believe because I'm in a monogamous relationship, I do not need to use a condom because my partner and I, we are faithful to each other. We do not need to use a condom. So
But
these are
in
some of
terms
the
of fertility, if they choose not to use a condom and they're really not looking forward to having children or anything of the sort, none of them actually want to have children. So that means that they will have to try to practice some other method. So if not the
yes,
barrier
I'll be coming to that.
method,
We have
yeah,
some I have some other methods I will talk about as well.
okay.
And if the condom is used right, it's used the way that it is supposed to be used, it's 98% reliable in preventing a pregnancy. Yeah. The other one, the female condom. The female condom is also made out of the polyurethane material, and it's a sheath that covers and lines the vagina. So the condom, it has some rings in there. So when you put it in there, the rings are they are held in it's so the condom is held in place by the two rings. So when and it's you don't need a prescription for it. You can come up to the health center, the wellness centers. We have them available. I find that women's condom are not very popular. Not too many people
No,
use
they're
them.
not very popular. And you know, when you said um it lines the vagina, you know, so many people out there think that the vagina is on the outside of the female
Yes,
body. So
yes.
it actually has to go inside.
Inside. So you
Yes, I
actually
think
have to
we,
insert it inside.
yes.
Yes. The female condom actually has to be inserted inside. It's not like the male condom that goes on the outside. So it has to go inside because your vagina is inside. So that canal, because a lot of women like to push their hands in there, that canal that they like to push your hand inside of there, that is the vagina and not what is outside.
So what is outside is
It
actually
can
the vulva.
the vulva. That's it.
Yes.
It's called the vulva. So it helps protect against STDs. So if as a woman your partner does not want to use the male condoms, you can empower yourself and you can use the female condoms. So it also protects you from getting an STD, and it is it must be inserted before intercourse. So you do not wait to put it when the man is just ready to go. You have to put it inside. You have to put it in there before.
And
It
it can
cannot
be
be
inserted a
and
few
if you
hours before, right?
yes. So you if you're using the female condom, then you don't have to use a male condom because some people
You know, some
if
people
you
like to say double protection.
well that's it. It's your preference. It's your preference, but you don't have to. And again, the other disadvantage of it is it may reduce sensation for both partners. So that's another disadvantage, and
And
maybe that's one
also
of the
the
reasons why
rubbing
people don't
might
really like.
cause them to
It
the
might
friction
dislodge
might
it
cause it
as well.
yeah, to both of them to
Yes,
burst. So one
yes,
or the other.
yes. And the other thing too is, um, when we're using condoms, we have to be very mindful that they're not. They're supposed. There's a little chance that it's not 100%. So some people, depending on their sexual preferences, the act itself may dislodge the condom. Because I'm sure we have heard of people saying the condom burst or the condom stayed inside of there, all of those little things. So all of that we have to be very mindful of, and maybe those are some of these are some of the reasons why persons don't really like to use the condoms.
And also, nurse, I think in terms of some of the accidents that happen with the condoms, could it be sometimes that the size that they use is not the correct size for them? If it's too loose or too tight, then it
Yes,
reduces the how effective it will be,
it will
right?
work. Yes. Also, too, when you are using condoms, I inform my patients that you need to check the expiration dates because condoms, like everything else, they do
Exactly.
have expiration dates. Another thing too is sometimes men and women like to live. They have condoms in their wallets. They have them in their vehicles, and the temperature, the sun. You have your vehicle closed for the whole day. Even that temperature can disrupt the effectiveness of the condom as well. Having a condom in your wallet for 2 years, obviously, I mean, no, that does not work. The condom
Two
that will
years.
disrupt
Wow.
the effectiveness of a condom. So what clients need to remember is you need to replace them. So it is not wise to leave condoms in your vehicle and they're in the car for the whole day. Sometimes you don't remember. So I always tell them you keep it somewhere that you can have quick access to it, easy access to it.
Yes, they need to be stored properly.
Yes. Was Elon saying something?
Oh, I said different time. When you have the gills, you hide it in the car.
Well, that too, but what you have to do is make sure that the condoms were not there for like 3 months or 2 months or a month. So you make sure that the client you need, guys, ladies. And another thing too, I tell ladies, ladies can also carry their condoms. You do not leave your fertility and your protection up to the men. You can also have your condoms with you.
Definitely.
So these are the two barrier methods that are available at our wellness centers, and they are free. You come in at any time and you ask for them, and you will get them. Then we have the hormonal methods of contraceptives.
Which is the other
So,
popular one.
yes, very popular, where we have the orals and we have the injectables. So we have, but because most people think when you say contraceptives is injection or tablets, but a lot of people do not remember that condoms are also a form of contraceptives. So the oral ones we have available at our wellness centers, we have the microgynon and the logynon, which are combination contraceptives. And then we have the mini pill, which is the one that we usually give to a patient after they have had a baby. So with the mini pill, you use this one until the baby is about 6 months, and then you will change to something else. So the injectables, we have Depo-Provera, which is very popular. That is the most popular one that we have. A lot of women are on that. We also have the Noristerat, and we also have the Mesigynine. With the microgynon and the logynon and the microlute, we have available a 21-day packet or a 28-day. So with the 21 days packet, you take the tablet for 21 days, and then for the next 7 days, you do not take any tablet, where your period should come during that time. With the 28 pill pack, you have 21 tablets which you take, and in the 7 days, you would have iron tablets that you take, and your period should come within that time. Some people, when they're on the tablets, they don't see a period, or they see a period. Depends. Like I say, it's also individualized. It depends on the person. With the contraceptives, it has to be prescribed by a doctor. The only time it's not prescribed by a doctor is if a patient delivered and there's 6 weeks postnatal, then it can be commenced by a midwife.
Nissa, I want to ask you a question.
Yes, please go ahead.
Why is it that sometimes when female change from one contraceptive to another in terms of the microgynon or another, they still happen to get pregnant?
I didn't get that.
All right, you have persons who've been using microgynon for a while, and I think at one time there was a shortage.
Right.
No pharmacy had it at one time, so persons actually go out and then start using a different brand, or something different, and then thinking that they're safe, they still happen to get pregnant. What would cause that?
Okay, so when I teach my patients, I always teach them that when you're starting, so for example, you're starting microgynon today, for the first 7 days of using the microgynon, you are not considered safe. During that period, you may still be able to get pregnant. So when a patient is changing from one contraceptive method to another one, I always inform them that within those 7 days in changing, either you use a barrier method, which are our condoms, or you do abstinence. Yes, because within that period,
which is actually another one of our contraceptive methods, right?
Yes, abstinence. Yes, it is a contraceptive method for some people. So within that period, you may get pregnant if you do not use a barrier method or you do not practice abstinence. Another thing
That's
too
very
is yes. Another thing too, I inform the patients is, if for some reason you went to the doctor and doctor placed you on any antibiotics because you're taking the oral contraceptives, for those 7 days that you are taking the antibiotics, you are also not protected from getting pregnant. So you can get pregnant during that period, but your doctor is supposed to inform you that you're supposed to use a barrier method during that time as well. So there are a lot of different little factors that patients are not informed of, that they're not aware that if you're on antibiotics, it can diminish the protection that you have from your contraceptives.
So that really brings up the importance of the counseling when they come to the family planning clinic.
Very much so.
That they could have all of those discussions.
Yes, because sometimes some patients, they do not come to us for contraceptives, they see their private doctors. And sometimes I am not sure if those teachings this counseling is being done by those private doctors. Because when they come to the clinic, As they come and they're pregnant and they tell you, but nurse, I was on this, I was on that. In doing your history, when you take in your history, then they will tell you, well, I was on antibiotics for whatever reason. And then I will tell them, well, that's one of the reasons, that may be one of the reasons why your contraceptive failed, because you're antibiotics and you were supposed to be using a barrier method.
Okay.
Another
That's
thing too is in our solution culture, a lot of people like to take what we call cooling. They like to take what do they call it? Lock. You know, they like to tell you I'm doing a cleansing. So during that period as well, because you do not know what you are taking in there, that can render your oral contraceptives useless as well.
I also remember somebody mentioning to me one time that they were taking some. Is a cleanser? Some is it the charcoal cleanser? Or is charcoal? Yeah, something like that. Charcoal
Mm-hmm.
cleanser, and then
Mm-hmm.
whoops, the person got pregnant
Yeah.
unintentional.
Yes, because
Yeah.
yeah.
So we have to be
So
very careful in
mhm,
how we mix what we mix with our contraceptives, right?
very much so. Very much so. So for the microgyne, and it's available at the health center, and it costs $6. The Logynan costs $9, and the mini pill costs $6. But in everything else, if a client comes to the wellness center and they run their contraceptives, and they come and they say, nurse, this month it's really hard, I am not able to pay for it, I still give it to them. So that is not a deterrent to not coming to get your contraceptives. You go, you speak to the nurse, you say, nurse, things are a little hard, I'm not able to pay for the contraceptives. We will still give it to you. So
That's true because
do not say that, yeah. Do not use
finances can really be a barrier for some people.
do not say that I don't have the money, I will not go to the health center, and then you get a pregnancy that you did not plan. You come to the wellness center, and we will give you the contraceptives, and we'll just write you because
Okay,
because for me I say it is better to owe the government $6 than to have to take care of a child for 18 years. In an
no,
unplanned pregnancy that you do not want.
that makes sense, eh? And I like that. But nurse,
Yes.
while you make it sound so nice and smooth, I hope most nurses are like you in terms of no serious, because sometimes if somebody come there and like they don't have the money for real,
Make them
some
feel
nurse might be
embarrassed.
embarrass them. Come to think of it for $6. I mean, you can hear about this situation.
No, I don't. I
Listen,
don't.
hence,
Because
I hope most
mhm.
nurses have that same mentality like you.
Well, we all should, because during meetings we are always being told those things.
And you guys you guys took an off, no?
To help yes,
Okay, right,
you're supposed
right,
to help. Yeah.
right.
Erlen came out really, really
Yeah.
emphatic on that, and I suspect Erlen may have some knowledge of something. So,
So also we have the injectables as well. So we have the Depo-Provera, which is given every 3 months. Sorry. So I tell a patient the Depo-Provera, which we use for patients who may not remember that I have to take a pill every day. So for some people it is easier to take the Depo-Provera. You take it every 3 months. So for 1 year you only get 4 injections. I tell them look at it
you
like
just
that.
have your appointment date to return for
Right,
the
right.
follow.
So I tell them you look at it like that. That makes it easier. You say to yourself, okay, I have to take contraceptives only 4 times for the year. That makes it an easier sell.
Yeah,
The
man.
Noristerat, you take it every 2 months for the first 4 doses, and then you take it every 3 months thereafter. And also with all of those contraceptives, we always advise our patients the first 7 days. If you have unprotected sex, you may be at risk for having an unplanned pregnancy.
So that is very important. That 7-day window
Yes.
for starting and also for changing your contraceptive.
Yes, it is. Yes, it is.
Let me ask you. While we on contraceptives, I know persons do say like something like they tie their womb or they put a clip, whatever. Tell us some more
Yes.
about that.
So these are the
I'm
methods.
coming to that. Yes.
Get into that.
So yes. So we have these other methods where we call them they call sterilization. So
Okay.
that too is a form of contraceptive where you have the lady, she ties her womb, her tubes. So they have surgery, and what they do, they tie and burn the fallopian tubes to prevent pregnancy. And
Somebody's
men,
asking. Somebody's asking. Is it literally tied or clip? What's there?
yes. So I have never gone into OR. I do not know what they do, but when patients come out, I always read their notes. They actually take sutures, they tie them off, and then they burn them. So that's two ways. That's to ensure that this woman does not get an unwanted pregnancy that she doesn't want.
So that's the fallopian tubes. Some
Yes.
people. You mentioned it. You spoke about the female reproductive system earlier. So just to remind them that the tubes are where the eggs pass through from the ovaries before they get to the womb, the uterus. Okay. So if you clip that off, there's no way for the egg to get in there.
That's it. And the other one is for men, which is called the vasectomy, which is a very sensitive topic because most men tell you, I am not going to do a vasectomy. It is permanent male contraceptive. So what they do,
he said a little bit speechless.
oh my God. So what happens is a lot of men do not agree to that form of content. It's not very popular in our island because we know our men, having a child is the ultimate goal, having children is the ultimate goal. But in the metropolitan countries, it is very popular. A lot of men do vasectomies. Some people actually do vasectomies to prevent themselves from having any kids.
True.
But
we spoke about you spoke about tying of the fallopian tube or the tubes, whatever. How long should a woman have that for? How long? 2 years, 3 years, 5 years until the end of time? Because
it's permanent.
Reason why I'm asking, I was just something that's crossed my mind. Like, is it going to affect the woman long term or short term? Because already your body have a way of itself, making sure that it cleans itself the same way you have your eggs being every month you have that cycle. You understand? So
when your tube
everybody
having your tubes tied does not prevent you from menstruating or any of those things. All it does is just prevents you from getting pregnant. Yes.
Nice. Okay.
Prevents you from getting pregnant. So we also have what we call our long-acting reversible contraceptives. So this one is the IUD, the IUCD, the IUD, which is a small device that's shaped like a T that's inserted into the uterus. So some of them, so we have two types. There's the hormonal one and there's the copper one. What we have in our setting is the copper one, which usually it has to be put in by an obstetrician or physician. So any one of them could do it. It can last from 3 years to 10 years. And it's when you have that in there, I mean, you don't have to worry about getting pregnant because what it does, it makes the cervix very what's the word I want to use? It doesn't make it good for sperm. So sperm it thickens the cervical mucus so the sperm cannot do what they want to do in there. So it makes the area very hostile to the sperm. So when you have an IUCD, the possibility of you getting pregnant is very low. I think if any patient gets pregnant with an IUCD, that means the IUD was not placed in properly. And I know people who have gotten pregnant and say, "No, I had an IUD." And I know people who have gotten pregnant as soon as they remove the IUCD, they got pregnant. Yes. So a lot of IUCDs are not very popular with a lot of women because they tell you, "Nurse, when I put that thing, I smell." They say they discharge as an odor. But of course, again, hair education and counseling becomes very important. You let your patient know that you're putting that in there, you should not be having an odor. What really causes you to have an odor is if you're having multiple sex partners, or you're faithful to your partner, but your partner is having he has other partners. So of course
So
he
why
gets an
he?
infection. He gets
Why
an
is he?
infection
Why
from
is
one
he? Why you
person.
say he have other partners? Why he?
But I said before that, I said the lady might have multiple sex partners. I said that.
Why you
He,
say
he didn't
he?
hear that
He.
part.
Oh, so 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 the woman might have multiple sex partners. She might be using a barrier method with one, or not using a barrier method with any, and those partners now have their own partners. So you see all of that that's happening there. This person has three partners. This one, and we know in our setting that's what happens. Somebody has two partners. A woman may have two or three partners. A man may have two or three partners, and because of our alternative lifestyles, let's say you have John and Mary. Mary might be thinking she's sleeping with only John, but John might be sleeping with Cheryl, Sandra, and also he might have Mike and Andrew. So yes. So we know that. So, and maybe John has not been having protective sex with those people. So if any of them has anything, he will pass it on to Mary. And then Mary will tell you, I have an IUD and I'm smelling. My discharge is this. I tell my patients, you go and see your doctor, let them take care of you. And then from there, we will see what is going to happen. Because just maybe the discharge you're having is because of all of that unprotected sex. So sometimes when you think you're sleeping with one person, you might be sleeping with six people.
True.
That's
So,
something
in
to think.
fact, you should not have any foul smelling discharge because of an IUD. That is most likely related to some kind of infection, right?
Infection, yes. So if you have an IUCD and you notice any of those, please get yourself to your primary care physician, or you go to see a doctor, a DMO at the health center, and they will take it from there.
Okay,
Okay, nice.
nice.
Perfectly said.
Now,
Yes.
nurse, I don't know if you have any other methods that are available at the wellness center or the hospital, but I know there are some others. I don't know if you want to speak about one that's very popular in St. Lucia is withdrawal. People, the pull out method.
You belong.
Yes,
Bail
pulling
out.
out before
So, let me give
ejaculation.
you another name, bail out.
Yes, a lot of people like the bailout. Yes.
Nice.
The risk of getting pregnant is most highest with the bailout,
You hear
because
that, Dylan?
you you
Repeat
may
that.
think that once you're pregnant, the risk of getting pregnant is highest with the bailout. Because what happens is, you
Pre-ejaculation.
may think that you ejaculate when you're about to have an orgasm. So you pull out. But there's what we call pre-cum, where we have 20 million little guys in there as well. So those little guys, they when you think they're not in there, they're already in there because pre-cum has gone in there, and then you pull out, and then you're like, but I did, and that's how when men come and say, but you're gonna be pregnant for me because I did not ejaculate inside of her. But you have
Mhm.
already dropped 20 million little men in there, little soldiers in there, because they like to call them soldiers. 20 million little soldiers in there in that pre-cum, and then the lady gets pregnant, and then you say, oh, it cannot be mine. So, we have to be very mindful of that as well, because that precum is what's going to put you in the shit.
And there's another one that is, I find, somewhat common, but maybe uh, I don't know if to say it's dangerous, but maybe not as effective as some people think. So
The natural method.
the natural, but also the emergency contraceptive or the morning after. Some
Oh
people
yeah, I
would
wanted to
take
ask you
it,
about that.
they take
Yeah.
it as though they're taking the other pills that you talked
Right,
about, the
Yeah.
microgynon
right,
and thing.
right.
So they would be taking that several times in a month.
So
Can you talk a little
you
bit about the
yes. So
emergency
Right, and
contraceptive?
how?
I'll talk about it in a minute. Let me just talk about the
Okay.
natural method. So we
Okay.
have, some religions tell you you're not supposed to be on contraceptives. The Bible says, "Be fruitful and multiply." So they preach that, "Be fruitful and multiply." So you have a lot of very Catholic. I'm not bashing any religion, But you have a lot of Catholic people who do not believe in contraceptives. They tell you they use the natural method, where it involves tracking the woman's fertility cycle, and you avoid sex on her fertile days, or you use a barrier method. That works. I mean, the rate for that is about, let's see, about 99% if it's done correctly. But sometimes you're supposed to be monitoring that, and then you have some issue which comes up. You're so flustered, you're stressed out because you have a family to take care of, you have children, and you forget and say you forget you're supposed to be tracking your cycle. Your
And not
husband
only that,
comes.
like, even though we have the calendars that we have on the phone, we put on the phone and so on. Sometimes just different changes in our lives make our cycles turn upside down, and they're not always the same.
Yes, being ill can cause that. Being
Mhm.
stressed out. Sometimes you take a little trip to go overseas. When you come back, your entire cycle changes. So there are
Exactly.
various reasons. So this is something you have to be very meticulous when you are doing. Very
Nurse,
meticulous. Yes.
I want to ask you a question. I growing
Mhm.
up at one time, I heard that if somebody have multiple sex partners, their period can also alter the period as well.
Yes, that too. And that's a lot of men. I have male friends, and they tell you that's how they suspect that the lady is seeing somebody else, because they think because her period changes that she has somebody else. But but today we are going to learn that there are various factors that can change your cycle. So sometimes maybe the medication you take, it might be the change in what you eat. Sometimes you may eat some because you're so stressed, you eat so unhealthy. All of that can change your cycle. So there are a lot of things that can change your cycle. Yes. Another method of birth control that a lot of our women use is called lactational amenorrhea method. So I have a baby. I have had 3 children, and every time I have them, as long as I am exclusively breastfeeding, I don't see my period. So a lot of them tell you that's my contraceptive method.
Mm,
Sometimes sometimes it may work, sometimes it may not work.
true.
For some people it will, some people it won't.
That's true.
So I am not advising patients to use that as a form of contraceptive. For some people it may work. I had a family member who, as long as she breastfed, she would never see a period. But some other person will breastfeed exclusively and they will still see a period. So it's not something that is it is one size fits all. It is also individualized. So what may work for one person may not work for another person.
True. True. Again.
So
Person's bodies are wired differently.
yes. So we have all of those different methods that we can look into. So um these these are some. So that's why we're educating them so they can know. Fun, you wanted to ask your question a while ago.
Oh yes, I wanted you to explain a little bit about how the emergency contraceptive or morning
Morning
after
after
pill
pill.
should be used, because some people seem to abusing it.
Like a gummy bear.
Yeah, because
Yeah.
some people think that they can take it several times in a month.
Or yeah.
Just, yeah, yes.
Yeah.
And because probably sometimes it's because they have multiple partners. So if they feel, maybe I did something, okay, I'll take it today. And a week later, they take it again. Is that how it should be used?
Okay, so emergency contraceptives are called emergency contraceptives for a reason. Um, you take that up, so what it does, it prevents implantation of the fertilized egg into the lining of the uterus, and it prevents the sperm from joining the egg. We have it available at the center as a tablet. It's a one-time tablet that you take up to, I think it's, correct me if I'm wrong, for
Five.
72 hours.
Yes,
I think
72
72
hours.
hours after having unprotected sex.
But it should be
You're
taken
supposed to
as
take
soon
it
as possible after, but up to
as soon
72 hours.
as possible, but up to 72 hours. But the trend that we have been seeing is a lot of women they have unprotected sex, and they go and get a morning after pill to take. And they do that maybe 4 times a month, 5 times a month, three times, you know, it's that is not the way it is supposed to happen. It can cause, so if you're not taking it well, it can cause pelvic inflammatory disease because you're taking it more often than you're supposed to. It can cause some of them to have become infertile after a while because you're just injecting all of these hormones into you. And it can cause a risk of increased ectopic pregnancy. Recently, two patients came to me and they said they came to see the doctor. And I'm like, okay, you can see the doctor. Why? Because they need a prescription for the emergency contraceptives. Initially, the plan was not to have prescriptions for those. You should be able to have gone to a pharmacy and say, I have had unprotected sex, and I would like to get the emergency contraceptive. So because I do not want to be pregnant now. But the way they're going about it now, I think because of the misuse of the emergency contraceptive, that now you need a prescription to get it.
Oh my. But that defeats the whole purpose.
Yes.
It defeats the purpose, but I think because of the trend that they're seeing, because two people told me when they went to the pharmacy to get it, they will ask for a prescription. I
Wow.
don't know if it's
I
I
was
don't know
not
if it's the
aware of
norm.
that.
I don't know if it's the norm, but I said I have to
Okay.
go to the pharmacy to find out if that's true or if that's the norm or if that's something new that just came up.
So it's a rumor,
Okay.
more or less.
Yeah. Well,
Because more or less you were supposed to be able to go and get it, but you know a
so
lot of
that's
women they're
something
using
for
it.
further
They're
investigation.
using the yes, they're using the emergency contraceptive as contraceptive as a way to prevent them from getting pregnant.
Mhm.
But you're not supposed to be using it like that. These things need to be done, be used sparingly. So if as a woman you you are having unprotected sex and your partner does not want to use the condoms, you should empower yourself and find a method that works for you that is going to prevent you from getting pregnant. So you do not have yourself being taking that emergency contraceptive so often that eventually when you are ready to get pregnant that you have difficulty with your fertility.
I think this is a very important point. And one of the things that comes up quite often is that some women like to say that the pill makes them put on weight. And I don't know what the complaint is. I have not heard the complaints for the injectables, but definitely for the pill, you get that a lot. So,
Well,
what would you advise them?
I mean, we have women who say that about the injectables as well. But when a woman comes for the first time, for her, she comes with a prescription for either orals or the injectables. We do a whole teaching with them. So we have this manual that we use, and you always tell them about the side effects. So that side effects can be, and you tell them you may or may not gain any weight. Some women actually put themselves on contraceptives to gain weight. I know a few of them who told me
Really?
that's why they want it. Yes, they want to gain weight because their
That,
friends say
that
I am
must
on
be
the pill and I gain weight.
interesting people because I don't know many women who want to put on weight.
I know a few who are on the they want to be on the contraceptives, but they want to be on it for weight gain as well because
Oh
they heard
wow!
about it makes them gain weight.
I've
Yes.
never heard that
Nurse,
one.
nurse.
Mhm. Yes.
Well, I've studied the female anatomy
Mm.
for, for a bit, but let me ask you a question. In regards to
Uh-huh.
the contraceptives, I think sometimes I've heard ladies have a conversation as if in relation in relation to cis, does that contribute like does it affect the ladies in terms of
Well,
having them having a cis or hypo? There's another thing apart from cis. There's another thing called
Not the fibroid.
fibroid. Is there any truth to that?
Never
well,
heard that.
I have never heard that. Um,
I've never heard it
I
myself.
don't know if there's I don't know if there's any link between fibroids and contraceptives. That we will have to do some research on
Yes, we will have
because
to do some
I
research.
have we have not heard that.
All right.
Now our time is almost up in this, but there was one little thing. Well, it's not a little thing, so I will have to ask you to do it very, very briefly. There's just one thing I wanted to ask in terms of whether contraceptives can be given to minors and what the process or the procedure is, because we know that there, although minors should be using the abstinence method.
Yes, yes.
Many of them are not practicing abstinence.
Sex is for
So
adults.
sex is for adults, but some of them are sexually active. Some of them, is it just the way Ulan said it? Sorry. Some of them are sexually active. So what is the procedure if a minor would be put on contraceptives?
So a minor cannot come to the wellness center and say, I came to see the doctor to put me on contraceptives. Has to have a guardian, mother, father, brother, sister, legal guardian, or a legal guardian, not the person that they're living with or the person they're having sex with, to come to see the doctor and to put on contraceptives. It is a sensitive subject. For them to be on the contraceptive, it must be advocated by the mother or the father.
Okay.
Now we have
Okay.
a lot of we have some minors who are very busy. They're very busy, and sometimes the parent, to protect them from getting the pregnancy, they will come and they will come and tell you, I would like to see the doctor because I would want to place her on the contraceptives. So it is
Injection or
something that, yeah, injection or the pill, whichever one. But they cannot come to the health center and say they're 14 years old and come and say, I want to be placed on contraceptives. The
Okay.
mother has to be there, or a legal guardian has to be
Okay.
there.
So
They
when
cannot
we
come on
say
the
a
contraceptives.
minor, we mean anybody under the age of 18, right?
That's right.
For that
Anybody
purpose,
under the age of
right?
18, yes, for that purpose, your parent has to be there,
Okay.
or a legal guardian. Because the legal guardian might be the godmother or the aunt. So that's why I say the legal guardian,
Okay.
the mother
well,
or the legal guardian.
if you're having sex, use a Durex.
That's an
Will
ad
be
for a
something else.
particular brand.
Okay.
So, Nurse, our time is up. It was such a pleasure having you. I think you did an excellent job. You explained
Thank you.
everything so well. And I look forward to having you with us again.
No
Um,
problem.
I
I am
think Uzan
happy to be
enjoyed it.
here.
Yes, I
Erlan,
think.
Erlan, yes, Erlan made it very enjoyable.
All right. We are very happy that you did it. I think you explained everything very well. You went into detail, and that is very much appreciated. So I hope for the listening public now you know um, a lot more about contraceptives. There's some interesting things that you said that I was not aware of, and also there are things that we now know we need to do a little bit of research on. So just to end this, I would like for you to tell us what
Yes.
day you have family planning clinic at the Beaufort Wellness Center, so that if we have any listeners in that area who would like to access the clinic, you can they can come to Beaufort Wellness Center.
Okay.
Unfortunately, I don't have the days for Soufriere and the various wellness centers in Choiseul and so on, but hopefully at some other point we can always just plug it in.
Yes. So for Viewfort, we have family planning schedule clinic every Monday at 1 p.m. in the afternoon. But if for some reason our patient is not able to come on that day, we still are able to do it for them. Whatever day they come, we will do it for them. We
Okay,
accommodate
so you
them
try to
however they
accommodate
come.
them.
Yeah. So if the
Okay.
person comes on a
Thank
Friday and saying, "Look, that's the only day I have off," we will do it for them.
Mhm.
We do not chase away anybody who comes for family planning.
And that is wonderful health promotion. We cannot chase people if we are promoting health. Okay, so thank you so much, Nurse Catherine. It was a pleasure having you, as I said before. And I know that we've taken you away from a very busy clinic day at Beaufort Wellness Center, your medical clinic, and so many other things happening on a Monday. So we really appreciate you joining us, and we hope that you have a wonderful day.
Thank you so very much for having me. I enjoyed my time on the program.
All right. And
Okay.
thank you to our listeners. We have come to the end of our session. It went by so quickly.
Yes, sir.
Yes, it went by very, very quickly. And I hope that you gained a lot of knowledge from what the Saint Catherine shared with you today. And we look forward to having you with us next week. Louisa will be with you at that time.
All right. Hey guys, so till next week, God's willing. Enjoy what's left. Well, enjoy. Have a good Monday. It's early. It's just mid morning. So have yourself an amazing day. Likewise, a week. All right. Be fruitful. Hey, have again an amazing day. Till next time, God's willing. Bye.
Casualty 911, 10 a.m. to 11 a.m. With the consultant. Welcome to